Professor A.K. Gupta, MD Homeopathy. We know that he is always helping us and a well-wisher of IFPH. Let us research work in cases of motor neuron diseases, patients in homeopathic consultant and gold medalist. President and Homeopathic Medical Association of India, HMIE, Delhi State. Founder, Director, Om Vidya Institute of Homeopathy and Allied Medical Sciences, accredited in Limca Book Records. Advisor Media, ET Healthcare Excellence Award in 2023. Author of The Problem of Child and Homeopathy. Here, his website is www.ovharms.com. Today, his subject is need for independent status for homeopathy. We are fighting for a long time. We know that many people, those who are in the highest position in our advisory board, we are fear they will engulf us. The allopathic world try to engulf us with their strong hand. So we must be independent. We must have an independent. So Dr. Gupta sir, you are most welcome to our platform. You can start now. Now for the 45 minutes will be the class, and after that there will be a discussion part. So you can start now, sir.
Am I audible, sir? Am I audible? Am I audible now? Hello?
Yeah, audible, sir.
Yeah, good evening and greetings from New Delhi to all, homeopathic lover and homeopathic people attending IFPH all around the world. It has been my proud privilege to be talking to you all on the very, very important subject of the need for independent status to homeopathy. Well, it is a matter of really concern that though we have got a good recognition in our country under the Ayush, but unfortunately, there had been not that we have been not getting the total due what has been required. Hello? Can I share the screen, please? Well, and it has been very, very important in today's scenario that homeopathy should get its independent status. Since homeopathy has come from Germany, probably that might have been the reason that in Ayush, since it's not being considered as an indigenous medicine, so that it's not getting its due. This could be the reason, or there could be some other reasons also. If there are other reasons, we need to understand and discuss and introspect very well. Lately, in couple of webinars of IFPH, there have been a discussion on the ongoing Supreme Court petition against homeopathy. So this is one very important aspect that we have been doing brainstorming and with the legal expert advice also taking from various corners of the world and deciding about it. So we need to strengthen ourselves all together. We need to understand this and take a very strong step rather than sitting over these kind of onslaughts. Firstly, we must make ourselves clear and unite together for the cause of homeopathy, analyze the pros and cons of homeopathy, need to be understand our strength and must accept the shortcomings which we need to cover up. I won't be surprised if there are few who might be thinking that at least there is an umbrella protection to homeopathy in Ayush, and asking for independent status might not be detrimental to homeopathy. So it is very important to be discussed. Why we need that? Okay. Why is it needed? First, not because being given as it's due in Ayush, and second, skepticism and criticism. These are the two major reasons. Or what are the grounds we can talk about that we need to have an independent status for homeopathy? As we all know, there have been enough of scientific explanation and evidence to grant this status. Homeopathy has done enormous research and provided treatment to the acute and chronic conditions and to the all kind of a medical healthy conditions with success. But despite of that, things have not been working out as it should be. Why is it needed? Because homeopathy has given patients a separately safer and effective treatment option, which other systems they do not provide as far as the homeopathy gives. As we say that homeopathy ensures health safely, and it is the one particular reason where homeopathy works with beds of treatment with minimum of adverse effect or side effect, or the least of any side effect on the person's personality or health in the economy of the health of that particular patient. Better avenues, ways to integrate with modern medicine. If we have been given a status of independent status for homeopathy, we will have better avenues and ways to integrate with modern medicine. And I'm reminded of, thank you to Dr. J.D. Daryani, sir, who had just called me, a few moments before the starting of this webinar, that he did wanted to be attending this particular webinar, but unfortunately he had to go somewhere and he has excused himself. So I'm really thankful for Dr. Daryani's word of appreciation and all that. It would, once this status of independent research has been given to homeopathy, it would encourage research where we on our own, rather than being following the same pattern of ICMR guidelines every time, what have they been giving, and we have to follow those particular things. If we are having our own status, then we can definitely say the research, depending on the individualistic approach, the patient need to be individualized, need to be selected the remedy for that, and under those patients only need to be given that kind of a medicine and for the experimentation. But if the patients of arsenic is not there, so any number of dose of arsenic would not give any result into that patient, which would give us like in a blind cases also. And eventually, those people make this kind of a study that gave the same medicine to almost everyone without having individualization. In our case, until we have the individualization done, we cannot, give the remedy. So this has been the, basic strength of homeopathy. And once we are given an independent status, we would be conducting researches on through these fields and will be able to showcase much better results. India should lead the way, the world, as India being the hub. And today, when we are, organizing this G20 summit here in Delhi, India has been proud. I've been feeling very happy that India has been considered a real hub in homeopathy, in teaching, in research, and in practitioners. India is the one country which has got the maximum number of homeopathic practitioners. So, with these kind of things, definitely we would look forward that we should be getting a independent status. These were the needs. Now, how to do that? Well, as I said, it's not a a very easy thing to say to get an independent status, but I am just giving it's a food of thought to all the homeopathic fraternity, that whether we need it or we don't need it. If we need it, why we need it, and if we don't need it, why don't we need it? And if we really need it and want it, then what are the things which we have to do? And if we are not getting any due regard or recognition of homeopathy as per it deserves, then also we need to do a lot of introspection and open with an open mind and open heart. And once we do that, uh, how? Rigorous research and clinical trials would be the one thing which can put a foot much stronger on the basis to go in for asking for the independent status. We have to work hard. We neatly require rigorous research with clinical trials. Though they have been done, but it has not been acclaimed, it has not been seen as per the requirement which gets the proper recognition. There have been number of studies which have been conducted during the COVID time, but and successful papers were presented during the World Health, Homeopathic Day. But very sorry to say and feel bad that they were never acclaimed by the government. It was never acclaimed by the Ayush. It was never acclaimed. It was not presented into the time. And there was a time when during the COVID time, the guidelines were given. In that guidelines, homeopathic approach had only 3 or 4 lines. And out of those 4 lines, with their arsenic medicine was given, had arsenic album a misspell in each line. So this kind of a lacuna is there which we need to correct and on our own. Recently, as we've been seeing that case of Phillips, so there we need to work comparatively much harder with the rigorous research and clinical trial. And with a self-regulatory framework is another point where we need to work hard. And if we really do that kind of a thing, we can be a good candidate for self and independent status. Enhanced medical education would be one particular step to go in or asking for independent status for homeopathy. Though there is a good education, there have been number of colleges have been opening and there are number of institutions have been there. But the practical training and the clinical training is the one aspect where we have been lacking. So we need to work hard on that side also. Public awareness is a one very, very important aspect. Unless we create that kind of awareness, since we do not have got any lobby as per the, we have got our counterpart, the modern medicine, they have got a lobby in because of the pharmaceuticals and all that. So what we need to do is we need to do a lot of public awareness, about homeopathy, and right from the school time. School children, they should be given or taught about the effects of homeopathy, how it has been working, because incidentally, there was a one paragraph given on homeopathy in English for the translation or for the comprehensive paragraph, which was said that it is a pseudo medicine. So if this kind of a literature is being given to the young mind, so we can understand and how would be that impression creating to the young mind. So if we give a good education along with the public awareness at a school level, college level, and even on a social ground, that definitely will help a lot for the recognition of homeopathy in a proper manner. And there have been a lot of misconceptions and myths which need to be busted very regularly, because the concept, the misunderstanding, myths, like, you need to take a lot of precautions. There are a lot of do's and don'ts for the homeopathy. And first, homeopathic medicine would aggravate, it would bring out the disease first, and then only it will give you the. So there are certain lot of myths which we need to take care of. And media coverage of the counters of to the negative news. Now, this is very, very, very important aspect where, as I said, that how we can proceed for this asking for a status, independent status. Because up till now, what has been happening, if there has been any onslaught, there have been any criticisms from any corner of the world, like, whether it is a placebo therapy or whether it is, having no effect, or latest being arsenic has been given and it has got a poisonous effect on liver. So these kind of things have been publicized in newspapers, TVs, and other channels. So what we need to do is, what is required, that the media coverage should be there for the counter of these negative news also. But what happens is, and up till now it's been happening, that they have been writing a letter or they've been sent a notice and we feel very happy. This is not going to work out, because the general people, general masses have not heard your side of the story. They have not been able to understand the whatever the allegation, whatever the misconception or false information has been given to the public by these various channels. They have never been negated by the authorities. So media has to be taken into account. For all those negativity should be countered by the media coverage also. Collaborative healthcare at national and international level. The more we involve ourselves in the collaborating with the healthcare of the national and international levels, it will really give us a better footing for asking for this independent status. And that can happen only once we have shown the good results and we have shown the efficacy of the medicine. Plus, we have quenched the what are called queries of the skeptical people or the scientists, those who have been talking against homeopathy. Insurance coverage is another very important aspect. Once, if we ask that, insurance people to incorporate homeopathy into their coverage, there are a lot of people who would like to take homeopathy, but they are not taking homeopathy because their medical expenses is not covered by the insurance. And we lose number of prospective patients to be treated and cured by homeopathy because of we do not have the insurance coverage for them. So if we are able to get this, that will also add on for the welfare of the patients as well as the welfare of the society and homeopathy too. Research funding is another factor. When we get this private bodies as well as the government funding, if there are private institutions or private companies or the government gets together and they do funding for the research, the quality of research, the extent of research, and the number of fields of research would increase to showcase and tell the world the efficacy, the beauty of homeopathy, and being treated each and every type of a case with no toxicity and the best of effects. Yes, government support, though in India we do have, but as this particular issue of the Supreme Court, so there have been a little a dicey situation. So we need to safeguard ourselves. We need to safeguard the homeopathy at large. Ethical advances. Advertisements should be ethical. There had been some issues that a lot of homeopathic doctors, whether novice or the, old ones, they've been putting a lot of advertisements which are non-ethical, making false and tall claims. And once the people, when patients, the crowd goes there, and if they do not find that, claimed results, it gives a bad name to homeopathy. So we need to see that their advertisements have to be very, very ethical. We need to see it should not go beyond the reach, because every system has got something to offer, and every system has got uh, its limitations also. So is the homeopathy also. It has got its plus points, it has got its limitations. So we must understand our limitation, we must understand our potential, so that we can give the justice to the proper patients. Patient-centric approach. Now, this is another which is very, very important aspect from my point of view. Like there are a lot of patients who want homeopathy because they have tested, they have tried, and they have been benefited. But those patients have been little, on a edge of a corner of edge. Whenever they listen some kind of a negative news, so they keep their trust also dwindles to some extent. So we need to see from that angle the patients, those who have been staunch supporter to homeopathy, they will, definitely stick to it. But there are people, those who have just, started homeopathy with a, half-hearted, because considering that they came to homeopathic doctor only after trying each and every system and finding not much of a relief, then they start thinking, okay, let's try homeopathy, because if it will not help, at least it will not have any side effect. So we need to change this concept that people should not come to a homeopathic doctor for this reason, but on the other hand, they should come for the efficacy, for their non-toxicity, and cost effectiveness. Certainly, these would be the reasons for which patient-centric approach has to be taken into account. And regulation of homeopathic practitioners. It is also a very important point of view, point from my point of view, that we need to have the regulation for homeopathic practitioners. There have been a number of times that the one particular doctor has been following one particular methodology of treatment. Well, I've got nothing against them, but the only thing has been, when they say that this is only homeopathy, that should not be the case. Homeopathic doctors, they, self-styled or claiming themselves to be the only right homeopathic, doctors, is to be avoided. And unfortunately, there have been cases that if a patient has come from a first homeopath or goes to some other homeopath, so instead of, appreciating, or they would criticize. So this particular regulation should be there, that no homeopath should criticize the other homeopathic doctor in front of the patient. If you have some kind of a discrimination, or a discrepancy, you can discuss with the doctor directly, rather than giving this false and making claim that the other doctor who has given you the treatment was wrong. Quality control and standardization in pharmaceuticals. Now, it is also very important, because sometimes, we have been seeing that we write down the medicine and they take the medicine and it does not work. We give the same medicine from our place, it works. And as on date, in homeopathic pharmaceuticals, their basic earning is coming from their own patents. It is a very, very big question to whether to go in for that or not. But I definitely would like to say that all pharmaceutical companies, at least they should start putting in their pamphlets that homeopathy is an individualistic system approach treatment. It is individualized treatment. It is advised that you should see a good homeopathic doctor for the timing, as long as you are taking this particular specific or particular patent. If it does not help you, it will help you, but it may not cure you. So if you are looking for a cure, please seek the consultation of a proper homeopathic consultant or homeopathic physician. So if little bit of pharmaceutical companies making this, it will make a lot of difference in the mind of, people, those who go for the OTC, over the counter drugs are available and they take it, because it is a really very big problem for homeopathic doctors. When a patient asks, I've got a headache, can you give me some medicine? So it becomes very difficult which medicine to give, because there are more than 700 medicines for the headache. So to select the one, it would be very difficult. But if those pharmaceutical companies they've come out with their some patent, they give some headache medicine and it helps, it's okay. But please write down in the pamphlet that homeopathic treatment requires individualistic, analysis, and proper medication is done by that particular treatment for the cure. If this is being given, we are being educating our patients. We are, without making any dent on the pharmaceuticals, we are educating people in a right direction. Because what happens is, suppose somebody is taking a patent and he keeps on taking, considering it to be a something good for rheumatic pain. So he keeps on taking rheumatic pain supplement, but he might be getting some relief, but he does not get completely cured. So after a certain period of time, he start thinking that homeopathy is also not work for me. So this kind of a situation will not come if the pharmaceutical companies start writing as a caution or as a disclaimer or as a whatever it is, they start writing into the pamphlet and making a note of for the patients to do that. Then, of course, strong representation and leadership. Uh, it is definitely a one very important aspect for which we need to be, pressing ourselves hard so that we get a good representation and leadership, so that we can talk to the government, we can get the things done. Because at the time of COVID, despite of having very good efficacy, we could not pursue ourselves into the government mind, that CCRH could not, instead of that, they should have taken a lead and asking them, but somehow there we need to churn up. I'm not against anyone, I'm not saying anything, but yes, we need a stronger representation and leadership, which will definitely help to grow homeopathy in all front, and getting a status for the independent homeopathy. Remember, achieving these goals require collaboration among practitioners, researchers, policymakers, and the public. The process will take time, but with dedication and evidence-based practices, homeopathy can potentially become a more established and accepted independent system of medicine, and can become the first choice of treatment, which we are always looking forward to. Steps to be taken. Government agencies and homeopathic associations need to work hand in hand. There have been number of times the medical associations have got certain points, but it goes to the deaf ears, because there have been no proper hearing from the association, because we have got number of association, and every association claiming that this is the biggest one, this is the only association for homeopathy. So what we require, we need to come out with a one strong association for homeopathy. Like, you have got IMA. So IMA has got a lot of weightage, but incidentally, we do not have got any association which has got a weightage. So we need to work on that also. We need to promote the evidence-based practices. Like every doctor has been doing very good cases. They've been curing number of patients, but unfortunately, they have not been keeping the records. They have not been much of the evidences, so it cannot be proved. Educational campaigns is important. As I said, that even during the school, college days, if these, universities areas, and we incorporate homeopathic education with their, routine medical or hygiene and physical health. If some part of this has been given to them, homeopathy, so they can understand the efficacy of homeopathy, beauty of homeopathy, and non-toxicity of homeopathy. engage with critics. Now, this is really a very, 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 very important from my point of view. What we have been lacking, that whenever there is a criticism, we keep mum, saying if we talk about this, we are giving publicity to that particular person rather than clearing our own point of view. So I had a couple of experiences when I talked to different individuals on certain issues. So I was told that, by bringing this to the social media, we are highlighting the negativity which they have been projecting. But I fail to understand, why can't we do that? Engage the critics and call them over on certain meetings at a national level or international level, or those who have been causing, criticism to homeopathy, and let them come on a platform, have a discussion, have an opening, have a, this thing, their point of view, let them listen our point of view, and then probably their mind also can get changed, because they've been fixed notions in their own mind, or they've got biased. So that bias can be only changed when they have been doing interactive session with the homeopathic community, homeopathic leaders, or homeopathic scientists at certain platform. Call them, invite them in any of the seminars, any of the conferences, wherever, like this, Philip Abbey, who has been a staunch criticism for homeopathy. Call him over sometime in one particular association or particular gathering where the scientists get together, maybe with the CCRH and NCH and all that, or even NIH. They can jointly come together and talk to the person, and probably it can be an eye opener to those people also. Now, the media relations is another thing where, which we have to be worked hard. I have not seen any media report citing any big achievement or big cases coming from NIH, from any particular organization on organization level. When we have these seminars and all that, we listen them. It sounds very nice, but if there have been certain, researches or certain cases, specific cases done, treated successfully, they should be publicized in media, print media, as well as electronic media, by the authorities, to give the weightage, to give the acceptance, to give the knowledge about that what homeopathy has been doing. And we have not been getting even a single coverage in any media, because what people are doing, everybody is doing on their personal level. I've treated new cases. I might give them in one press. It might get printed. It might not get printed. But if it comes, there is a breakthrough treatment in some particular disease, like doing very critical cases in IPD of NIH or Nehru Homeopathic Hospital, or any institution for that matter. It should be printed. National-wide coverage should be given. Incidentally, I really do not know whether we are a government agencies of the three, apex agencies, NCH, NIH, and CCRH. Do they have got any allocation of funds, or they have got any, even a department for media relation or not? If they are not, it is my humble request that they should start thinking from this angle. Because if you see, like All India Institute of Medical Sciences, whenever there is something, it is being highlighted all over the papers, so that this kind of a case has been treated. Abnormality was there, so it gets highlighted. People are able to find out, that what's new. Like, we've been doing a lot of cases with the motor neuron disease. We have, doing good results, but again, not getting that publicity for that. The same kind of a thing people have been doing a lot of work in the cancer. Homeopathy has been doing a lot of, good work in cancer, but it is not been acclaimed because it is not being publicized. And as such, homeopathy, we do have a regular, treatment, as well as we are working very nicely as a complementary medicine to the, conventional treatment for the cancer patients or for the, life-saving drug, patients, those who have been on life-saving drugs, or even otherwise, like, chronic cases of renal failure, diabetes, or those type of patients, those who have been immunosuppressant. There also homeopathy has been helping people, those who are going under chemotherapy or radiotherapy. By giving homeopathic medicine, people have been made to tolerate that effect of bad effect of chemotherapy or radiotherapy in much better manner, and they have been able to complete that course of chemo as well as radio, which had been very difficult. Otherwise, the people suffering from nausea, different kind of a thing, and they are not able to complete their therapy also. So this particular aspect also need to be, publicized and made to understand to the other part of the, our colleagues. Patient testimonials, as I said, earlier, the patient's testimonials should be a one thing where people like today in the world of, digital world, when everything is available on the net. So if the testimonials of our homeopathic uh, patients are being definitely regularly put on the net or otherwise, people would develop much more, faith, and they will definitely turn out to homeopathy in much more number of, cases. And the efficacy of homeopathy would be really relied by those people by experiencing it. We need to have an expert panel. Incidentally, we have not been able to get it till date any center where we can say that, at remote area or even in cities and towns, patients have been going to different doctors, and doctors are having being busy practitioners. They have not been able to give that much time, or they do not have got that kind of a, facility of other doctors where you can have a separate department who will take a case, taking the other one to a, examination, that repertorization, and all those kind of things need to be done. If there are any centers, like any all the hospitals attached to the government, medical colleges, or National Institute of Homeopathy, whether it is in Calcutta or it is in, Nanglo, the latest one in Narela, we must build up our repo of that these are the referring centers, and those referring centers should definitely have their, result oriented cases showing to the people, showing to the public, and patients from private practitioners could be referred to those centers if when they find that they are not been able to do the justice or do the maximum despite of the best of ability, because they have not been able to give that kind of a, they do not have the team. So those particular patients should be referred. And if we are, today I find it difficult that to, if I had to send a patient, to where do I send it? So if these kind of things are there, certainly it would bring up a much more trust and efficacy to be reckoned with for people as well as for the homeopathic doctors too. Now, the transparency is another one. Incidentally, transparency about what we have been doing and what we have been showing. In certain cases, I'm not saying everyone, but there have been quite a good number of, times we see in seminars, in conferences, in congresses, like what have been shown in the to the people, to the doctors, to the youngsters, is something which sounds very nice, but exactly it is not the same. So instead of doing that, if we keep the transparency, we will have a much more better understanding, amongst the youngsters, and they will be better homeopaths, better equipped to say where have been their failures. Instead of talking every time our successes, we must talk about our failures also to our youngsters, so that they can understand if they are failing. So there's nothing wrong in that. They can again try. They can go to the, their senior doctors. They can refer their case to the, higher centers and all that. Because ultimately, it will be for the benefit of the, homeopathy and homeopath at large. Now, challenges in elevating the homeopathy. What are the challenges in asking for independent homeopathy? What are the pros and cons for it? I leave this to an open house, because this is, I have just given a call for this, that there is a need for the independent status for homeopathy. I am not the one, but it's an entire homeopathic fraternity which need to discuss, think, and talk about. And if we really have a good churning of mind from all angles, the pros and cons, we need to take a next step for that. And the ultimate mission remains is that homeopathy is recognized for the health, happiness, and harmony to each and everyone. As we say in India, Ghar Ghar Homeopathy, and Jai Homeopathy, Jai Hanuman, and thank you very much. And I would like to, have the views of the other people and all that we can discuss about. Thank you very much.
Thank you, sir. Very nice presentation, and you have done what to do for the next time. All doctors should do in the future. So this is an eye opener for others. Now there are so many people are waiting for you to hear from you. Now, Dr. J.D. Daryani, please
Sir,
unmute, sir, and you can ask your question. Yeah.
Well, am I audible?
yes, sir.
Yes,
Yes,
yes.
sir. Sir, pranam, sir.
Namaskar, Dr. Saab. Really, your lecture was very much impressive. Dr. Gupta, I must congratulate you, first of all.
Thank you very much, sir.
But the only point which I realize, and everybody will realize, that we are not united.
Yes.
We miss all homeopaths.
True.
We miss all associations. We miss the platform from which our voice could be raised. We are busy in our practice because we are, earning from homeopathy, but not paying for homeopathy.
Mm-hmm.
Now, what is the meaning of paying to homeopathy? That is the proper representation to the government.
Yes.
Luckily, in Ayush, it is H means homeopathy is given in the last. And we are giving a stepmother treatment that you must be realizing.
Sir.
Next, whatever courses are in India, I will not say about the European countries, because the jobs are very less. Job security is the main thing. And in public sector, it requires the publicity. And publicity means from grassroots. It should be started from grassroots. For this, we ourselves is not able to publicize, or to rather you can say that take the participation in the media, but it is from the government side. Day before yesterday, we will be not united. The things cannot be claimed, should be what Dr. Gupta want to say, that I will not repeat. But publicity from grassroots, that is from, I say, my slogan is, when mother is healthy, the child will be healthy. And if child is healthy, the nation will be healthy. So this is the grassroots. From beginning, we have to start with the publicity, media support, and that only government can give this type of support. Thank you very much. Thank you very much. There are so many things which we are not supposed to say anything in, but overall, I agree we should be united.
Thank you, sir.
Our cause is we must pay to our profession what we are going to earn and for where stream we have entered. So
Thank
thank
you, sir.
you.
Thank you.
Thank you
Thank you,
very
sir.
much. You
Thank
have
you.
given me sufficient time. Now,
Gupta, sir. It's
Good evening.
really a wonderful presentation at this time of crisis. As you, why I use the term crisis, because as you rightly pointed out that there are certain cases pending against homeopathy at the Supreme Court. As you all know that it is filed by an allopathic gastroenterologist from India, particularly from Kerala, has filed a case. But the parties in it that are one is a homeopathic doctor who is having no practice and he has stopped practice, and another is a group of people under IMA called Capsule India. So these are the three parties which are which have given a case against homeopathy, and the thing is that they want to damage or spoil the growth of homeopathy. As everybody know that homeopathy is the second largest system practicing all over in the world now, and particularly in India, lot of homeopathic the growth of homeopathic practice is really fantastic, and nobody could believe that this much of growth, the rise of in homeopathic practice is something unexpected from as far as the other people are concerned. They are doing super specialty and everything, but still homeopathic doctors are getting lot of cases, and all the cases were treated by the so-called modern people or highly qualified doctors. But still, homeopathic doctors are able to cure those cases. And this is to say at this juncture, and excellent session, as you pointed out, sir, because as the time is short, I am not telling more about that. Thank you, sir. You have covered almost all part of course, the publicity should come from government side, not only from the government side. It is not because of our lack of participants or lack of unity among homeopathic doctors, but the fact is that it never be the reason. They are saying that we are unscientific, and that is the reason. We will have to prove that this time. Definitely, the Supreme Court itself will definitely give the answer that this is the best scientific science in the world, because there is no change in our philosophy. There is nothing. Always a fixed philosophy is there, and the scientificity is something they want. Every change is supposed to be talking. The science is something that need to be changed, but frankly, it is not. Thank you, sir, for your excellent presentation. Hope
Thank you.
we can.
Our Vice President is there. Please, Dr. Shaji Kudier.
Thank you, Dr. Gupta, for coming to our forum once again, showing your deep interest and passion in homeopathy. Thank you for that. I also welcome Dr. Darayani, who is also present in our forum today, and all others who are watching this program. So I congratulate you for coming to such a non-traditional topic today to inspire homeopathy, the need for unity, and also to stand alone, because our system and our science makes a lot of difference from any other system of medicine in the world today. So we have a lot to establish, we have a lot to prove, we have a lot of scope and scientific scope in front of us in transforming science in general and medical science in particular. So all the things are in our shoulder as homeopathy doctors. So it is time for unique uh, action from us, taking leadership, especially from Indian homeopathy doctors, because we lead the world of homeopathy today. So we should understand it and take leadership in the world. So for that, we should need unity by understanding that the science that govern homeopathy is a holistic science, which is an individualistic science. So it is homeopathy is not only patient specific, it is also doctor specific also. So such a differences will be part of our scientific existence that we need to realize. So one other doctor may be different, evolve into a different prescription than myself. All these are individualistic realities that we need to understand. So nowadays, such scientific understandings are the one reason that divide us, that we need to broaden ourselves and understand in a scientific perspective. Anyway, I came here to congratulate you for coming with such a nice and timely topic as the case against homeopathy is coming to Supreme Court's consideration. Very not only simple, but in a very planned manner brought to the Supreme Court of India. So if they were able to succeed in Supreme Court of India, there will be a lot of destruction that will be happening in the homeopathy world around the world. As homeopathy is the most important inspiration for homeopathy come from India today in the world. Even this in IFPH has part of inspiring the entire world through our daily Zoom meetings. Many countries, South America, Portugal, Turkey, and many countries have daily inspirations from us, and they have themselves started many Zoom meetings after our initiation, doing every day inspiring others. So in total, I congratulate you. We are need to remain united, and we have a long way to go. And thank you for coming. Thank you, Doctor.
Thank you.
Sir, I would like to add one point more. Our Kerala government has given a fitting reply